My name is Adedayo Ashana. I am an orthopedic spine surgeon. I practice in Raleigh, North Carolina at Orthopedic Specialists of North Carolina. Today we'll be talking about a very common but often unrecognized cause of back pain, which is sacroiliitis. The sacroiliac joint, the SI joint, is a joint formed by the union of the ilium and the sacrum. This is a joint that is very important as we walk around, as we move. The joint is held together by a union of the bones themselves, but also a collection of really strong ligaments to prevent shearing and other types of forces. SI joint pain can be caused by degenerative pathologies, which is essentially as we age and get older, the joint can see a lot of stresses. Trauma can be another cause of SI joint pain. In many women, childbirth can also be stressful to the SI joint. Patients with sacroiliitis usually complain of back pain, and many times they complain of pain radiating down the legs. SI joint pain is very common. As in many clinical diagnoses, the most important factor is what the patient tells us. Listening to the patient often gives us most of the clues that we need. I look for patients telling me about transition of pain, meaning pain when they do shift from one position to the other. Oftentimes pain when sitting. Patients will often tell me they have to lean to one side or the other in order to take pressure off the joint. When I see a patient in clinic, the encounter starts with the patient telling us about the severity of the problem and things that they've done to help it, or sometimes things that have made it worse. After we get all that information from the patient, we then proceed to perform a physical examination. My physical examination typically includes examination of the back, which essentially tests the sensation, the motors, and different nerve roots. It is important to realize that SI joint is a great imitator and can present in many forms. After that, I do the SI specific examination. If it's positive, the patient will tell us they have pain in the back over the area that is typically representing the SI joint. Patients with sacroiliitis, SI joint pathology don't always get surgery. In fact, our goal is to treat these patients without surgery and only apply surgery when it's necessary. The things we do to try to help patients non-operatively treat the SI joint are things like steroid injections into the joint, oral anti-inflammatories, and physical therapy. When patients fail conservative modalities, the next step would be to consider surgery for those patients. And this is where we do the SI joint fusion using the iFuse. I perform the iFuse torque procedure with a minimally invasive technique, which essentially allows me to use 2 to 3 centimeter incision to approach the SI joint. I personally use navigation and robotics to determine best area to place the implant. Once that's done, we use the iFuse torque, which is a 3-dimensionally printed implant that allows bone to grow onto the implant and also through the implant. Typically, I use 3 of these implants to stabilize the SI joint. If any of the symptoms we've mentioned sound like something you've been suffering from, come to Orthopedic Specialists of North Carolina, OrthoNC, at our different locations to see one of our specialists. It is important to remember that we are a one-stop shop for the treatment of back pain. This includes things like medications, physical therapy, the injections, and if necessary, the surgery.